Good morning and good afternoon, everyone. My name is Megan Diamond, and I am the Assistant Director of Programs and Innovation at the Harvard Global Health Institute. On behalf of the Harvard Global Health Institute, Novartis Foundation, MIT Critical Data, and Harvard University Center for African Studies, it is my honor to welcome you here today for the inaugural DASH webinar, COVID-19 Health Needs and the Role of Technology in Low Resource Settings. This webinar is the first in a series which will bring together experts from around the world to explore the role of tech and AI in the response to COVID-19. These webinars were specifically focused on low resource settings or those with high socioeconomic disparity. In today's webinar, we will hear from leading policymakers in Africa, Latin America, and the World Health Organization about the most pressing COVID-related health needs on the ground and the role of technology in addressing them. We will explore lessons learned from previous infectious disease outbreaks, discuss emerging digital innovations, and hear about the role of international collaborations in scaling new technologies. These are really big questions, and we couldn't have asked for a better set of panelists to tackle them. I'm thrilled to introduce you to our incredible group of speakers on today's panel. We will be joined by Akono Tengela, who is the Program Manager for Mortality Surveillance at the Africa Center for Disease Control and Prevention. She joined the Africa CDC in 2016 as one of the first staff members, playing a critical role in launching Africa CDC and developing its first programs. Akono currently manages the Mortality Surveillance Program, where she was responsible for designing and executing the program strategy for understanding the numbers and causes of death in African countries, and is improving the use of data for decision-making. As part of the COVID-19 response, she's the Chief Science Officer and co-chairs the Sciences, Regulations, and Standards Technical Working Group under the Africa Task Force on Coronavirus. She also leads knowledge management platforms, innovations, and research for the COVID-19 response. Next, we have Marcos de Souza, who is the Secretary of Science, Technology, and Innovation for the state of São Paulo in Brazil within the Secretary of Economic Development. The area of science, technology, and innovation is responsible for actions to stimulate research and technological progress to encourage economic and social development. Prior to assuming this position in 2019, Marcos served as National Secretary for Innovation and New Business at the Ministry of Industry, Foreign Trade, and Services in Brazil, where he was responsible for a variety of activities, including innovation policies, startup programs, intellectual property regulation, digital economy strategies for the country, as well as R&D plans for the Amazon region. He leads the largest startup accelerator program in Latin America and the Brazilian strategy for impact investments in social business. Bernardo Mariano Jr. is the Chief Information Officer and Director of Digital Health and Innovation at the World Health Organization, where he is responsible for coordinating the WHO's digital health vision and strategy. Bernardo leads and oversees all aspects of information technology, data security, and enterprise applications, ensuring the WHO is advancing its digital capabilities to deliver its global health goals effectively. Prior to joining WHO, Mr. Mariano was a senior regional advisor to the Director General at the International Organization for Migration, where he was responsible for strategic oversight of IOM's activities within sub-Saharan Africa and advised on emerging trends and developments. Bernardo also held the position of Regional Director for the Southern African Office, where he was responsible for the management of the IOM field office operations, overseeing activities in 15 countries. Lastly, it is my pleasure to introduce to you our moderator, Anne Ertz, head of the Novartis Foundation. Since 2013, Anne has been leading an organization committed to catalyzing innovations that transform the health of low-income populations. Since 2019, the Novartis Foundation sharpens its focus to concentrate on how digital technology, data science, and artificial intelligence can reimagine healthcare around the world. passionate about improving health outcomes through data science and digital technology, Anne applies her relentless commitment to overcoming global health inequities to pioneer solutions that can advance health and care globally. Anne chairs the Broadband Commission for Sustainable Development Working Group on Digital Health, is a member of the Governing Council of the UN Technology Bank for Least Developed Countries and the International Advisory Board of the Commonwealth Center for Digital Health. Anne has authored numerous publications on digital health, infectious disease, non-communicable diseases, and public sector partnerships, rather multi-sector partnerships that address global health challenges. Before we get started, I have just a few housekeeping messages. We'll be running the live Q&A at the end of the webinar, so we have enabled our Ask a Question feature on the bottom of your screen. If you have any questions during the webinar, just pop it there and we'll do our best to answer them. This video is being live streamed through Zoom, Facebook Live, and a recording will be made available on the DASH website afterwards. Lastly, we hope you will join us this upcoming Tuesday, May 12th at 9 a.m. Eastern Standard Time for our second webinar, Data Mining Large Internet Networks to Predict COVID-19 Hotspots. We have an exciting panel lined up, so please visit dashinafrica.org for the web details, which will be posted later today. With that, I'm excited to hand the mic over to Anne, who will be leading the discussion today.
Thank you very much, Megan, and it's a real pleasure to be here with you today, and thank you everybody for attending this first webinar of DASH, and welcome to our fantastic panelists, Bernardo, Acona, and Marcos. It's a real honor to moderate this discussion with you today about how technology can better address the needs related to the COVID-19 crisis, and what is more important for getting to the right technological solutions than defining properly the needs. So it is a very wise choice, I feel, to do this first webinar on defining the needs in a different context of the world where COVID is currently running and spreading around. So without further ado, I would like to delve into the discussion and ask a first question to our panelist from the African CDC, Acona. Acona, the African CDC has been built very fast, I believe, over the past years to really improve coordination and technical expertise across the nations in Africa to address diseases such as COVID, but also all the other health problems around the continent. And you are the best place to inform us more about how the situation with the spread of coronavirus in Africa is heading forward, and where you see the biggest needs in Africa for technology to help addressing the problem of coronavirus. Because I also would love to hear from you. From the African continent, there is such a wealth of experience and expertise in how to handle epidemics, as you have unfortunately faced many different epidemics in the past years. So if you could highlight us a little bit about, on the one hand, the real biggest needs you see that can be addressed with technology, but also on the other hand, the strengths of the African continent in how to handle a crisis like this pandemic.
Thanks, Anne, and thank you, Megan, for the introduction. I'm very happy to be part of these discussions to represent Africa CDC. And you're quite right, comparatively, Africa CDC is relatively new. Africa CDC was established in 2017, but however, since July 2013, or even before that, during the Special Summit for HIV and TB and Malaria in Abuja, Nigeria, the heads of states and government identified a need for Africa to have a public health institution dealing with African issues and run by Africans. And so the core mandate, as you rightfully said, for Africa CDC is to safeguard the health of Africans by supporting member states during situations like that, to build up their capacity as well as capabilities, and also be able to respond adequately to public health emergencies and events. And so how Africa CDC does this is by harnessing the available resources within the African continent and supporting collaboration between countries, researchers, and other partners. So if we look at the coronavirus situation, currently we have 53 member states out of the 55 that have reported cases. So Lesotho and Western Sahara are probably the only two countries that haven't reported any cases. Looking at this morning at our dashboard, we had more than 50,000 cases that had been reported, with over 2,000 deaths on the continent, with North Africa reporting the most cases and deaths. And as you mentioned, with Ebola and cholera and all kinds of outbreaks that we have here in Africa, Africa does tend to have a slight advantage of having the biggest burden of infection diseases globally. So allowing countries to be slightly more prepared for using community health workers, for example, to conduct the necessary tracing of contacts and cases through already established programs for HIV, TB, and malaria, for example. So, however, there is still a lot that needs to be done on the continent to ensure we catch most of the cases. And if you think through the technologies that we need, we definitely need to ramp up our tracking and tracing, which is something that artificial intelligence could actually support us with. Of the cases as community transmission increases and as countries move towards conducting mass screening and testing. These are things that having good technology will be really important for us to have. And so it's really important also to ensure that physical distancing measures that fit the African context are adequately in place to prevent excess transmission, especially in areas that there is like overcrowding, overpopulated public transportation, for example, as well as with the most vulnerable group. And so technologies such as AI can support in many ways in monitoring overcrowding, public transport, and also all these other limitations that Africa are currently facing. But then importantly for Africa, community engagement is really integral in ensuring the success of any response for any outbreak response. And so contextually, Africa is quite different from other regions. And what we've learned from previous outbreaks is that building community leaders and champions is really essential for any response, essentially. So that's my response, Ed.
Thank you very much, Akona. And I do agree, there's a lot, a very big importance of creating these champions in the community, but maybe we come back to that in a later question also. But let's take the opportunity to look at another continent and another context. Marcos, Sao Paulo is one of the epicenters of COVID-19 in Latin America. And on the other hand, even though there's a lot of cases, we also see a lot of innovations coming up to address the crisis with technology and other innovations. But could you tell us a little more about the factors that potentially contribute to this high number of cases in Sao Paulo, and how technology is already being used currently to address the problems, and how you are even looking at localizing or tailoring validated solutions that worked well, for example, in China, and how you are tailoring them to the local context. Can you tell us a bit about that, as you are at the leadership of all these innovations in the state of Sao Paulo?
Sure. Thank you for the question. The first question is about the factors that are contributing to the large number of cases. One of the reasons is because Sao Paulo is an international city as New York and London. It's a cosmopolitan city that attracts foreign people, and also the national citizens circulate a lot through Sao Paulo city. And it's the second largest city in Latin America, so it's a huge population, and that's why the virus has spread so quickly in Sao Paulo. Another reason is the low social distancing adoption by the population. The government is struggling a lot to press the population to stay at home. On average, the social distance is around 50% of the population. Sometimes below to 48, 45% in São Paulo state. So it's a risk situation that we are discussing about what to do next in order to enforce more hard measures in order to contain the virus. But the work that was done in São Paulo has started in January, when some specialists from the government health department has identified the virus in China. They start to plan and make all the acquisitions 2 months before the first case in Brazil. So we had some times in São Paulo, at least, to prepare for this. And about the technology that we are using to tackle this challenge, we are using some technology that some other countries are using. We are, to identify this people movement in the city, in the state, we are using signals and from telecom companies, data from telecom companies, and also from some startups in Brazil that has the possibility to geo-referencing for advertising in online shoppings, in online sites. So we are using different startups with different technologies in order to have this monitoring control in São Paulo. And these data that are collected, they are used in the epidemiological models that we are using in São Paulo to define and take actions about the crisis. We are also using all the common technologies through social media, as WhatsApp and Instagram and Facebook. We are using hard this kind of technology in order to prevent and inform the population. The government of São Paulo has also launched an app that it's possible for the population to identify symptoms if they have some symptoms about COVID. This app was developed by medical clinical people from São Paulo. And another challenge that we are having is not so much about new technologies, but technology that we were not producing in Brazil, that were producing in China, for instance, or in other countries. So we have a lot of actions have been made in order to produce ventilators in Brazil, reconfiguring large plants from automotive, from ICT companies in order to produce this kind of ventilators, and also the nationalization of some inputs and reagents that are produced in other countries, and now we are in a nationalization process in order to do that. So these are the technologies that we are using, but about the acceleration of these new innovations is something new in São Paulo, in Brazil also, because when the crisis started to appear, we had a huge mobilization from universities, private sectors, investors. Everybody wants to help. The problem is that to help with technology is different to help with traditional products. Technology sometimes have to be adapted, sometimes have to be tested, sometimes have to be integrated. And all this process is really difficult in the government in order to address, mainly in a crisis situation. So what we did was to understand that technology is not traditional product. And what we did is to create a program in order to have an open innovation strategy in Brazil, in the São Paulo government, in order to map all the journey from selection of a technology and the scale up of this technology. Because there are some technologies that everybody thinks that's ready, but because of the novelty of this virus and the situation, it has to be adapted. And so what we did is to map all the journey. We create a special public procurement of innovative solutions, because the government used it to buy things that are ready and tested. They are not used to buy things that are in development. So what we did is to have an open innovation strategy where we mobilize all the local innovation system and to have one single window in order to access all the technologies that we will be using against the COVID. And we use the largest R&D center in Brazil, together with the largest hospital in Latin America, that's in São Paulo, Hospital das Clínicas. We've made a partnership where they analyze all the technologies that the market offer. We have two possibilities. The market can offer the solution for the government, and we have another that's a demand from the government. So we, as a government, we want to buy this kind of technologies with this kind of performance, and so present your proposal. So we, using this one single window, we are able to mobilize a network of technology evaluators to identify if the technology is properly for the combat against the virus, and if the technology is robust or ready to be implemented. With this solution, okay, the Secretary of Health and the hospital decide to test. So we have all the technology will be tested in this hospital in a real environment situation. This hospital is the epicenter of the combat against the virus in Brazil. And if the test of this technology is okay, the government can procure or adopt this technology and scale up for the rest of the country. And we also integrate venture capitalists in this phase in order to support startups and medium companies that have been proven the technology and has the agreement to be acquired by the government. So we put additional money with venture capitalists, and we also add internationalization support for this company. So they can test and adopt in São Paulo, but we will support them to scale up to Brazil and other countries in Latin America. And to do that, we are in a partnership with the Inter-American Development Bank in order to spread this technologies approved in Brazil to other countries. So these are the main solutions that we are doing to accelerate the development of this technology implementation by the government.
Thank you so much, and very impressive. I believe this is going to be very helpful indeed for the rest of Latin America. And your point about the technology is not necessarily the cure, but how it is deployed and applied and integrated in the system is the main challenge. And that is a perfect segue to Bernardo from WHO. I think, Bernardo, we've seen a lot of creative approaches already to tackle health issues with digital. Since you came to WHO, it's accelerated a lot. And I know WHO is a partnership with WhatsApp also to deliver health information in the COVID crisis, as well as with Facebook to combat misinformation. So I think these are wonderful examples for the world. Now, we would love to hear from you how WHO is strategically thinking of how to bring together the public and private sectors players to address the different needs in the coronavirus crisis, and how to coordinate that, not only the development of the technology that has to respond to the appropriate priority needs, but also the deployment and the integration into the health systems. Can you tell us a bit about that?
Thank you, Anne, and thank you for having me here. Indeed, we have three fights going on as we speak. One is the fight on the clinical side, on therapeutic as well as vaccine. The other is on the digital health. How can digital solutions support the fight for COVID-19? But the third one is the cyber security side, and how we can as well ensure that as the whole world goes through this, we ensure that there's privacy, there's data is safe, and there's ethics, and so there are three streams or three areas of fights that it's going on. The front lines, we have the health workers in the front line, but we have all the digital tools supporting them. Let me dive a little bit on the digital tools or digital health solutions. Now, the digital health solutions, of course, better preparedness means a better response, and the tools that are matured enough because of the preparedness phase, they are right now being rolled out at a much easier pace. Now we have the new tools that are on high demand, be it symptom checker, contact tracing, proximity tracking. All these are digital solutions that can support that clinical work that our health worker professionals are conducting on the front line. At WHO, we have been engaging with a number of private companies, private sector tech companies. I mean, all the tech giants, I have to say, plus the number of medium to small companies that have expressed the desire and an offer to support WHO. We have some 30 companies and 60 work streams on digital solutions for COVID, being currently ongoing in different phases of engagement to support the fight on these digital solutions for COVID-19. And I want to just take a moment to say to appreciate the gratitude and the great support that we are having from the tech companies that are currently supporting WHO. And within these work streams that we have with the tech companies, we focusing in five areas that I think is relevant that I can share with you those 5 areas that we are focusing on. One is the citizen engagement. So all solutions are on citizen engagement. But the second is supply chain, medical supply chain and logistics. We want to the challenge when the cure or the drug and the vaccine comes to play is available. We need to make sure that is available to all, let alone the personal protective equipment that also is in great need in many places of this world. And so the supply and demand is something that we are collaborating with a number of UN agencies and as well as private sector to work to make sure that we address the prioritization of this supply, and the technology behind it to support that. The information centers and the knowledge platform, this is something that we're also working with a number of tech companies on the pro bono. I have to say that when I say that the 30 engagements with the 30 companies with 60 work streams with the tech companies, those are pro bono engagements. So they have to say that it's not, the companies are not coming to us for profit. They're just coming to us because they want to collaborate. They want to join this solidarity to make sure that we all together fight to get rid of COVID-19. So the other area that we're working with a number of companies is the recovery and transition planning tools. And this is one area that perhaps we see that we don't have enough, and then it requires a lot more in terms of innovation. The simulations and the modelings do not have enough data to actually provide the accurate predictions. And if I can put a dream out there, my dream would be one day that if this pandemic happens again, we can be able to predict at least as accurately as we predict the weather, to predict the evolution of a pandemic. That's the challenge that I put to all of us, because we have the capacity, we have the computing power, and I think we need to just come together to ensure that we work towards a scenario where actually, when the virus was still in China, the predictive model could already alert countries what could be the scenario if A, B, C, D intervention is made. I think that's an area that we see that requires a lot of innovation, a lot of work, and we have a group working on that as well. The fifth area is what we call it digital solution clearinghouse. we see that ministries of health and many countries are inundated by many offers. It's very good intention from the many companies, but they just can't handle the amount and cannot triage which one works, which one should be in which solutions we should invest. So we are working together with our technical advisory group on digital health to build some a digital solution clearinghouse to at least narrow that number of choices so countries can see what worked where, and then be able to perhaps say, look, if there's an innovation that somebody's proposing, there's already something that is working in another country, so we can adopt that, so to ensure that the quick intervention that the countries can have will result in a lower mortality and as well as a low infection rate. We have to understand that as we move to the next phase of this pandemic, the importance of that collaboration with private sector, but the whole government approach to ensure that we apply measures as the country moves from high mortality rate to low mortality rate and flatten the curve, that needs tools that can allow policymakers and government officials and private sectors to quickly apply those measures that would save lives. So we are very, very grateful and very happy with the level of support we are getting from the private sector. I think we have never seen this much collaboration, and we hope that we continue to see this collaboration, not just with the private sector, but across the whole sector. And we have some non-profit organizations as well coming to us, and the last one, and being from Africa, and I'll be biased here, it was a digital volunteers from Africa that is basically a number of African entrepreneurs that decided that they will create a digital volunteer network to actually support countries with the digital solutions as they need to really develop the digital solutions that will support countries to manage, prepare, respond to the pandemic. So I'm very, very, very happy and to be part of this network of different players that normally don't interact much. At WHO, we do not interact a lot with private sector other than on a client customer perspective. But now we are forging partnerships to fight COVID. So we are very grateful to that. And then we're grateful to the governments that are supporting us, and then also to the foundation that are supporting us to be able to work towards the situation where countries manage well the curve, but also the coming out of the lockdown mode, and manage the whole let's say situation before the vaccine comes to play. So before we have a vaccine, we'll have ups and downs on these, and I think we need those digital solutions to support countries to manage the situation. Thank you.
Thank you very much. And yes, indeed, it is very motivating, in fact, to see that WHO engages so much with the private sector now, as it has to be a joint response to this worldwide crisis. So this is going to be one of the positive remnants of the crisis, I feel, and maybe we get back to that afterwards. And let me go one step back to Africa with Akona. You mentioned that tracing, tracking is really a very important need in Africa, especially for CDC, who's giving us daily updates of the situation in Africa. I wonder if you can tell us a bit about where the data come from. And then secondly, also, if you want to improve the tracking and tracing, as Bernardo mentioned, to get out of the lockdown or to get towards the recovery phase, we will have to increase our testing capacities as well. What do you see as barriers for that, for example, in Africa?
Great question on where the data comes from. For us, the data from member states comes from the situation reports at this moment in time. And we also make sure that we also conduct media screening, basically using the digital intelligence platforms that pull data from the different media sources throughout the day as part of our event-based surveillance. So we have the data verified by the focal persons at the regional centers of the Africa CDC, and that is how we then put our numbers together and display them on the dashboard. So of course, this comes with its many limitations for being able to conduct the necessary analysis for support of member states in the response. And so it's really difficult to understand the true burden of the pandemic to help us plan for the necessary deployment of resources. And so not only that, without adequate data forecasting, as Bernardo was just saying earlier on, and being able to use the digital tools such as AI and machine learning is really difficult, because for AI to be able to predict infections and accurately be able to hone down on the hotspots and the different zones and areas that need to be focused on, we definitely need accurate data to allow it to also learn and provide the correct projections of transmission. And so this has been really an issue in the African context. And I totally agree with Bernard. It's a dream that I would like to also see, because then we as Africa can also better prepare and be able to act rapidly and at a more speediest manner in terms of responding to all the outbreaks that are currently happening on the continent. And so in terms of testing capacity, so Africa CDC is trying to increase the testing capacity across Africa. In fact, I think a couple of days ago, or no, that was last week, we've launched a new initiative under the African Union that's called Partnership to Accelerate COVID-19 Testing, which is called PACT. And this is basically a partnership to trace, test, track, and treat cases across the continent. And basically, the aim is to ensure that at least 10 million Africans who would have not been tested have because of limited resources of getting tested and things, have the opportunity to also be tested within the next 6 months. And so this kind of partnership basically involves a lot of cooperation, coordination, collaboration, and communications from various partners, and basically taken from the overall goal of the continental strategy that we have as the African Union, which is to prevent severe illness and death. So we are hoping that this initiative as well will be able to address the barriers and challenges that we are facing and may be facing during the next wave of the outbreak. And these include being able to establish warehousing and distribution hubs across Africa with various partners. And we've had also some tech companies coming in, trying to see ways and how they can support pro bono, like what Bernardo has said, support supply chain and procurement measures as we implement this next strategy for Africa. And we have had a model that we've used previously successfully in terms of medical supplies and donations that we've received from foundations like Jack Ma. So basically working with various partners like WFP and airlines to help coordinate and have pooled procurement of diagnostics and other medical commodities. And the other collaborative initiatives under PACT is to ensure that there's proper, like you were saying, proper tracing of contacts and tracking of the cases. And so under this umbrella, we envision working with also the civil society partner agencies to support in the deployment of at least 1 million community healthcare workers for contact tracing. tracing. And so these community health workers would need as much support as it can in terms of the technological need to be able to track and trace the various contexts from the various cases, especially under through overcrowding and the most vulnerable areas. And so one of the barriers really that we have is the standardization of the technology platforms that can be used to pull the data being collected by these very community health workers on ground, and being able to monitor the testing data and also support the epidemiological models and critical health forecasting techniques, as I've pointed out.
Yes, this will be critical indeed.
Yes, definitely.
Very, very important that we track it well, and maybe a wake-up call for governments to invest in the right data and to invest in clear data in infrastructures, architectures, and interoperable systems, so that we can be better prepared to track diseases in the future. That's maybe a very good wake-up call. Thank you so much for that. And if we go back to the Latin American context, Marcos, in Brazil, we heard about the fantastic clearinghouse you have established in the partnership with the reference hospital for coronavirus and the government to validate technologies that are out there, that the government can then acquire them. We also know that Brazil has a very strong public health system. But São Paulo as a city is a huge megapolis, as you said. It's probably the second largest city in Latin America, I think you said. So it is also a city where I can imagine there's a lot of discrepancies between the populations. So there may also be populations or people who have no access to internet, who have no mobile phone yet, or who have other issues to access the right information or the right services. How do you see that technology or other innovations can help with bridging that divide? As we've seen in many, many countries, also in Europe and the US, that COVID is really making the divide between different population sections clearer and clearer, unfortunately, but it's a wake-up call for us all, I believe, in the world. So how do you in São Paulo and the Brazilian people look at that? How can we improve that with technology, potentially?
As you mentioned, Brazil, I think, has one of the largest public health systems in the world. And it represents around 50% of the total health sector in Brazil is public one. So what we are doing in this moment of crisis is partnering with the best private hospitals that we have in Brazil that already use a lot of technologies for their patients. And what we are doing is trying to, through this partnership, to develop new technologies and transfer these technologies for the whole system. As I mentioned, the Hospital das Clínicas is the largest hospital in Latin America. It's a public one, and it's the best R&D, health R&D center in Latin America. So the best the best physicians that we have in Brazil in the private sector come from the hospital, this public hospital in Brazil, because it's a university hospital. So what we are doing, the challenge is how to make these technologies available for the public system. And available for the public system, we are talking about large scale, but low cost, because it's not affordable for the government to pay the values that the private sector pays. So one strategy is to have a huge negotiation with these hospitals, private hospitals, and also with the technology companies. But another one that we are supporting really aggressive now is mainly on the digital field, is how to include startups and medium-sized companies, technology companies, using public procurement of innovation. This is something new in Brazil. It was not allowed until 2 years ago. Because of the scale and the trust in the technology, usually these acquisitions were made with large companies. What we are doing now is trying to change a little bit this profile for startups and also to small and medium-sized companies. Just to give you an example, in a project that we are developing the last 30 days, it's a project using artificial intelligence and machine learning in order to diagnose COVID in computed tomography and X-ray images. We first tracked these technologies around the world. We found the best one is from Huawei because they had a lot of experience in China. We are adopting now this solution from Huawei, but that needs some adaptation, some changes for the Brazilian reality. So this project has been led by this Hospital das Clínicas, this public one. It involves Huawei, Amazon, Deloitte, GE, and two of the best private hospitals in Brazil. The idea is to use this technology that was developed in China from Huawei, but at the same time, we are creating a data lake that will collect these images from 30 different hospitals in Brazil, 30 different hospitals that will supply this data lake, and will provide this data lake for the private sector and startup sectors in order to develop the Brazilian machine learning algorithm. And the best ones will be acquired by the government. So this is also an opportunity for economic development using public procurement and also to nationalize this kind of technology. And the most important of this strategy is that in 30 days, the initial test that we made has multiplied the results of these tests, of the image tests, by 5-fold. 5 times more was produced by each analyst, by each physician, in order using this algorithm. And another additional point is that because it's on the cloud, we can receive and give the results of these tests in any part of Brazil. So there are a lot of regions that don't have enough specialized people. They have the machine, but not so much people to analyze the results. But using this artificial intelligence, machine learning, we can create analytical centers in São Paulo and other states.
You can combine them for many more areas. Yes, that's fantastic.
And the result is really good on the productivity and also the accuracy to detect the virus. Usually PCR has 30% of false positives. Using this image, we are reaching 10% of false positives.
Really great. Thank you so much, Marcos. This is very important. And I think localizing validated solutions that work elsewhere is really a very good path forward as well. We have a lot of questions from the floor, but I just wanted to end this round of questions very shortly. Bernardo, if you think with all the different work streams you have, if there would be a top 3 of must-haves for example, tracking, tracing, or anything else that you think is very essential for addressing the COVID crisis, what would it be? In fact, this is already one of the questions from the floor.
I think, indeed, I think we have a situation where, for instance, telehealth and telemedicine is, from the technology perspective, I mean, it can scale up, I mean, immediately. From policy and regulation perspective, we need to unblock some of these policies and regulations to allow the technology to really, for governments to really unleash the potential of telehealth and telemedicine. Nationally first, perhaps regionally after, and then globally as well. Yes. So I think that's a lesson that I think the world needs to take away from these, that we need to look at the regulations for telehealth, telemedicine to really leverage that, because the technology is ready. Of course, the supply chain is key. The medical supply chain, Akona mentioned, and then I think this is every country now is looking at when can I get that medication or the vaccine as soon as it's available. So how can we prioritize to make sure that the medicine, the vaccine, and the medical supplies reach to the places and communities that most need. And of course, let's not forget the just the normal health systems that needs to operate, because we still have patients with malaria, tuberculosis, cancer that also need attention as we go through this pandemic. And the technologies can support countries to make sure that this is well balanced. If in terms of demand from countries right now, there are three areas that I see countries reaching out to us, and then we bring together a number of countries as well. One is track and tracing. The other one is symptom checker, because the absence of enough tests, the symptom checker is perhaps seen as a way to make sure that patients that do not need to go to hospital don't go to hospital, and patients that do not need to do a test don't do a test, because there's an overflow, there's a capacity of health systems that is challenged by COVID-19, and I think that's one area that we see a lot of demands. Health bots. There are a number of bots. A number of countries are putting out bots. I believe we need to use these opportunities to create a trusted network of health bots. Because if I am in Brazil, I want to talk to the health bot in Brazil. If I am traveling to Brazil, I might want to also talk to the health bot in Brazil while I'm still in Switzerland. So since we will be in this situation for a number of months, to allow the economic and social activities to resume to whatever normal situation we want to call normal, I think there's a number of tools that can help us navigate safely through the process of resuming back to normal, in terms of checking on the contact tracing, on the proximity tracing, on symptom checker, but also bots that allow people to have information at the right time and moment, and ensure that they seek the right advice, and then in whatever countries they go to or they are. Thank you. I mean, I just want to add that let's not forget the 51% of the population that do not have access to digital technology, especially because they are they don't have broadband. So we cannot just think on digital solutions, because there is a 51% of the world that still have no access to broadband. So we need to also keep that in mind.
Yes, absolutely, Bernardo. And that was one of the questions from the floor. In fact, what can we do to reach the people who don't have access to internet or online information through mobile internet? Do you have an idea how we can best do that? Maybe also with other innovative tools?
I think there's for that, with the midwife, the community engagement, community workers and health workers need to be part of the solution, to make sure that we equip both midwife health workers with enough the tools and procedures and capabilities to actually support those communities that are not necessarily connected via broadband. And we do have, we are just releasing a WHO Academy app that have classes. We have also Open WHO that provide literacy and lessons on COVID-19 and other help for health workers in other health areas. And those are the tools that perhaps we need to make sure that do not just reach to the point where the broadband reaches, but goes beyond that. So we need to reach out to those communities. And I think the innovation there comes from the local community. So local innovation for local problems needs to take place to make sure that we really make a difference.
I believe you're absolutely right. Thank you so much, Bernardo. I think, Akona, you also wanted to respond to this question specifically on how we can support that for people who don't have mobile phones or access.
So, thank you. And so this is one of the biggest challenges in Africa, because in Africa, only 23% of the population actually have connections to internet. So these digital platforms are really difficult to implement, especially in the most rural parts of the continent. And so one thing that we have done working with even telecom companies, and I think for some people it might sound backdated, but we are using telecoms to use SMS. And basically that's how we can reach our less technologically advantaged population. And I've seen that some member states as well have also opted to, although there are some ethical questioning in terms of privacy and things like that, working with telecommunications to use people's numbers to track them and be able to trace them during contact tracing as well. And so those are the kind of measures that are happening. Hopefully, with this outbreak, this will teach us that in Africa, we actually need to ramp up our digital sphere, because literally only 45% of the population actually has any connection to a phone or anything like that. And so these are really important considerations even for tech companies when they come to Africa CDC and present their ideas, to think this through as in how will you support the rest of the 70% of the population.
I think it's very, very important. Thank you again for making that point. And also the point about the opportunity we have, you both made it, Bernardo and Akona, the opportunity we have of mobilizing the more mature digital solutions like telemedicine or telehealth and SMSs, together with the more innovative tools that are data and AI driven, for example. That is the way our health systems of the future should be shaped currently if we want to address infectious diseases such as this one. So thanks a lot for these responses. With that, I have taken many of the questions I saw in the chat, not all of them, of course, but I think one last question for each panelist in 1 second, if you could say, what do you think the healthcare practices will be that will be changed forever now with this pandemic? Because some of the things will change. If it comes true, Bernardo, the telemedicine, the roadblocks or the regulatory blocks to telehealth are removed, and it becomes something that will be there forever and which will be very beneficial to many people in the world, for example. But what else would you see? And if you could say in one sentence, what is the practice that you would see remaining after COVID-19? You want to give it a start, Akona?
Well, it's an interesting question, because I think if ideally in a world where people are open and trusting in terms of telecommunication and telecom and innovations such as AI and machine learning, we should potentially see more health bots, as Bernardo was saying, where even for health workers, they feel protected in the sense that they don't need to fully engage with And so ideally, I think how we also address disease burdens as well as outbreaks, not just in the continent, I mean globally, I think it will change, and it will probably be informed by technology. It's just that I was laughing in my head because I'm thinking, well, in Africa, we still need to sort out the data issue, getting more data in order to be able to promote things. But then I think, I think that's...
Okay, thank you, Akona. Marcos, what are your thoughts? Is there anything after COVID that will remain as a permanent change in the health system?
Yes, I think telemedicine will be one that we're struggling to regulate, but now it's common here. There's no more problem.
Yeah.
But the next challenge is regulatory for health bots. This will be
Yeah.
the next challenge in order to scale up this kind of regulation for health bots.
Great. And you, Bernardo, what would be your take?
Yeah, and before I give my take, I just wanted to make a correction. I said I did the other way around. That 51% of the world is covered by internet broadband, but the 49 not covered. I think now the latest figures is a bit higher, but still 49 is a lot. I think the last time the world faced something similar to these, by bigger magnitude other than the Spanish flu, was the Second World War. And after the Second World War, many things changed. And I do hope that this was because of the wide impact of every sector. We will now realize that investment in healthcare is extremely important, not just for government, but also for private sector, because everyone is getting impacted. So investment of healthcare to make sure that the workforce of every sector remains healthy. I hope we see now a concentrated effort to prioritize by every sector, government, private, public, on that investment. The other element I hope that we'll see changing is the health data, or the issues about monetization or demonetization of health data. I think it's important that we look at health and health data as human rights, because that is core for our existence in the normal world and the normal circumstances as we used to be, at least until January for some of us, and then for others until as early as last month. But it is important that the world realizes that it's no longer status quo from where we came from. We need to change, and we need to leverage on mature technology, as Marcos say, and making sure that healthcare takes the center stage that should take a long time ago. Thank you.
Thank you, Bernardo. That's absolutely brilliantly said, and no one can say it better. I fully agree with you. Health has to be on the agenda from now on, and data as well. Thank you so much. And with that, our hour is up. I would like to give a tremendous thank you to our fantastic panelists from all of you. So big applause. Thank you so much for your super interesting insights, and it really helps us forward thinking more how we can exploit even better digital and data for addressing COVID-19. That being said, I would like to invite you all on this webinar to also join us for our next week's webinar that Megan announced at the beginning of this meeting. And thank you again for being with us. With that, I give the floor for a second back to Megan. Sorry to run over time, but it's almost in time.
Great, thanks so much, Anne. That concludes our first Data Science and AI Summits for Healthcare webinar. Many thanks again to our panelists, Bernardo, Akona, Marcos, and for joining us. We know how limited your time is, especially lately, and we're grateful to have heard from you and look forward to seeing the important work, or rather the impact of the important work that you are going to be doing. To our audience, thank you for joining us and submitting thought-provoking questions. We hope to see you on Tuesday, May 12th for the second webinar focused on data mining large internet networks to predict COVID hotspots. Have a wonderful afternoon or evening wherever you are, and take care of yourselves and others. Thanks so much.
Bye-bye. Thank you, everyone. Ciao.